our next speaker, Mayor Nathaniel Booker, who's the mayor of Maywood, Illinois. And Jen Childress, the National Forum's Director of Programs, is going to talk with Mayor Booker next to gain some insights from his leadership and experience working to improve health in his community and to, yes, strengthen the social determinants of health or the vital conditions for health and well being. So, Jen, please take it away.
Thank you so much, Mayor Booker of Maywood, Illinois, for joining us today. Can you tell us, was there a personal moment or experience that led you to make health, especially heart health, a priority for you and your community?
Hey, Jen, thank you so much for the opportunity. Um, well, I'll say it's a few different things that made me prioritize health for our community. On the one piece, what led me to move back home to Chicago back in 2017 was my father had a heart attack and passed away at age 56. So that was one of the biggest pieces that made me want to focus on health as an overall. When I fast forward from that move back home to today, I had gained 40 pounds after I became an elected official and just got so involved with everything. So, of course, my health took a change and I started feeling different. Of course, you're getting older, but health is health, right? The other piece was when I look at the village of Maywood, we make up out of 40 communities in the western suburbs of Maywood, we have the highest rate of heart attacks, the highest rate of diabetes, the highest rate of strokes, the highest rate of emergency room visits for mental health, and we also have the lowest life expectancy. So for me, it was if health can't be your priority, when I'm looking at elements of a healthy community, if we can get our residents to just have an overall better balance of health, then we would be a better community for it. So it's a all-encompassing answer of what led health to be the focus.
Absolutely. Well, thank you so much for sharing your personal story and just the power behind it from what you experienced on a personal level with your health, your father, and then taking a look at that with the data and how cardiovascular health is being lived as an experience within Maywood. So, can you share a story that illustrates how residents, local businesses, and your local health department have responded to the leadership that you've taken on health?
Yeah. So last year, what we did to truly start responding to what's going on with the health and getting everybody like all hands on deck, when we first launched with the Move with the Mayor initiative focus, we turned our kickoff and our series into more of our community meetings for the summer. So it became those every Tuesday, 7 a.m. walks, and it was just let's walk in different parts of town and talk about what's going on in this area of town. But it's also to get your body moving and getting health going, right? One of the other big pieces is we do monthly safe and wellness meetings. And instead of having those be indoor, we decided to make them outdoors at each different park around town. And we would have exercising and health fitness activities going on at those different events. So you can go to the different tables and talk about what's going on in public works, what's going on in building and code, what's going on in community engagement, or you can do some Zumba, or you can do some yoga, or you can do some chair exercises for our senior population. So I think the illustration of getting local businesses and teams to respond, this is the time of residents. We would get at minimum 100 of our residents to show up for these different events. So it's like, let's have your questions answered. Let's talk about what's going on in the community, but let's also focus on you at the same time.
Amazing. I love that approach of meeting people where they're at and really plugging in from an individual perspective to a community perspective and bringing that all together. That's fantastic.
Absolutely.
So, what's one example of how your city's helping people take control of their blood pressure or heart health within their everyday lives?
Yeah. So we partnered with Loyola Hospital, and every community event that we have that's going to have 20 or more residents, they're there with a actual team of people who are taking blood pressure for every resident, tracking where they are. They also have a specialist there who can give them healthy eating tools, healthy exercising tools, and then we also have different activities that they can do while they're there and get that information directly from the hospital. And it's really just making sure that you're taking better care of your health. They also offer giveaways in regards to you being able to take your own blood pressure when you get home at a later time. The biggest piece that comes out of that, we also have a partnership where we are doing food as medicine. So within our food as medicine opportunity, what we've been able to do is one, Each week, we provide 125 boxes of fresh produce to different residents through a partnership that we have with Dion Chicago Dream. So, what it is, it's no different than like an Amazon locker or a UPS locker where you just go punch your code in and then you get your fresh box of produce. In that fresh box of produce, there's a QR code that can give you different recipes and different menu options that you could take home and prepare for your food. So we have that at our community resource center that our residents come in, grab their box once a week, and they go on with their day. So each day, the company comes in and replaces that box in that locker. Also, with our Food is Medicine initiative, right now in the village, we're renovating a current building that the village owns that's right along our prairie path. And if you know about our prairie path, we are the first 21 blocks to a 62-mile trail of walkability and health. What we're doing is there's a building that sits on the prairie path. We're turning that two-story building into a Food is Medicine cafe. So right now, in real time, we're building out a community garden that'll have 35 large 8 to 10 foot beds. We also have the cafe that's being built out right now that our youth will be able to work in, but it also comes with a commercial kitchen that'll be different cooking demonstrations. So we've partnered with the U of I, University of Illinois Extension, and
Mhm.
then UIC to come and help cook different things, showcase food as medicine, work as our horticulture, and make sure our vegetables are grown, our fruits are grown, and work with our youth and work with our seniors and work with our residents overall. And then our biggest piece of food as medicine that we're really excited about is we have been a food desert for over a decade. And right now we have under construction our grocery store that closed back in 2009, 2008. So that facility will be reopened by September as a full service grocery store, truly marketing food as medicine with a pharmacy, but not only with the pharmacy, it's working on having built next to it a federally qualified health center where the doctor doesn't have to prescribe medication, but can prescribe food and fresh vegetables for you to go treat yourself. So that's a all around win that we're working on to save lives and help everyday people.
Oh my gosh, that's incredible. I absolutely love how you're providing the education, but not only that, the screening services and wraparound to help support people when they're away from the event. So it's not just a once a week thing, it's not just once a month thing, but they really have that as part of like every day and living and this whole support network. So kudos to you and your team for that. That's awesome. And so, based on your journey, what's one piece of advice that you'd give our audience about how to engage their mayors and elected officials to be champions for community health?
Well, first I would say is just help them understand that there's a Move with the Mayor initiative with the National Forum that really can help revitalize and engage the community. And there's toolkits so that you don't have to recreate the wheel. You just got to get on board. The other piece I would just say is truly when you're trying to get people engaged, try to find that story or try to find that narrative that's going on in the community that truly can pull the hearts of every person. Like, why wouldn't you want to do this? Like, so for me, when I look at our youth, when they're going to school, instead of with Takis and cheese meat product, now they're going to school with fresh produce, an apple or orange, a banana. That you like understand what your why is. So if you can get that across to your elected officials and be the change you wish to see, kick off a walk and ask your elected official to come walk with you. Kick off an experience going on in your community and just say, hey, can you join me? Can you be a part of it? And I think once you just start with those, I tell people all the time, it's the little things that mean everything to electeds. So if you're willing to make the steps to get it started, I'm sure if you tell that story right and create that narrative correctly, that any person is going to jump on board because health is wealth. And if you really have all elements of a healthy community as prescribed by the U.S. Department of Health and Human Services, they've been focused on social determinants of health since the 1970s, right? Everybody wants a thriving community. And physical fitness, mental fitness, behavioral fitness, overall life wealth leads to a better community. And that's just the story you have to sell.
Amazing. Well, thank you so much for being such a guiding light and champion. You truly walk the walk, and we really appreciate you leading by example. Where can people find out more about all of the great work that you're doing in Maywood?
Oh, absolutely. I mean, you can go to our Village of Maywood website, and that's www.maywood-il.gov. Or you can follow me on social media on my Facebook, Mayor Nathaniel George Booker. Somebody on my team or myself are posting something every single day. and just get involved and get engaged. We have a foundation called Healthy Maywood West Cook, where we not only focus on the village of Maywood, but we partner with our other mayors and our surrounding communities to truly inspire all of the health as wellness. So look out on that Healthy Maywood West Cook website as well, which is www.healthymaywoodwc.org. That just later next month, we're doing a partnership where we're supporting the village of Broadview right next door as we kick off the Move with the Mayor initiative. So Mayor Thompson will be at our event in Maywood, and then we'll be at hers over in Broadview to showcase that this truly is something that regionally, nationally, is a thing that needs to be focused on because, again, health is wealth.
Amazing. Well, thank you so much, Mayor Booker, and we'll all follow you and continue to amplify your great work. Thank you for
All
joining
right.
us today.
Thank you so much, and you have a great day.
Thank you, Mayor Booker and Jen Childress. Mayor Booker, your leadership in Maywood is a powerful reminder that improving heart health starts at the community level.